As we all know, in the early 80s, people, particularly gay men, began to get sick and they began to die. After a while, we named the disease that was killing them the acquired immune deficiency syndrome, and the virus that caused the disease, the human immunodeficiency virus. HIV/AIDS hit DC pretty hard. And even to this day, DC remains in an epidemic state related to the disease. Tonight, we are going to focus on the beginning of the fight against AIDS, and particularly, we are going to talk about how women stepped up to fight this disease in the early stages. And to that end, we have some distinguished panelists joining us. They are, to begin on my left, Colevia Carter, one of Rainbow History Project's community pioneers. She worked throughout her life to educate people about HIV/AIDS. Among her many achievements are organizing the first DC conference on women and HIV/AIDS, serving as the co-chair of Whitman Walker Clinic AIDS Education, and on the DC Human Rights Commission. Papaya Mann, to my right, another RHP community pioneer and multi-hyphenate performance artist, poet, and community organizer. She designed the first outreach media campaign materials on HIV/AIDS targeted to the African American community, served as executive director of the AIDS Project East Bay, the DC Cares Consortium, and African AIDS Watch. She has also served on numerous HIV/AIDS councils nationally. Patricia Nalls, here to my left, realizing most services for people with HIV/AIDS in the late 80s were geared towards gay men, founded the Women's Collective, an organization that provides programs and services implemented by women for women whose lives have been dramatically changed by HIV/AIDS. And the Women's Collective continues to operate today. We'll also soon be joined by Dr. Pat Hawkins. I believe we've just been joined by Dr. Pat Hawkins. Yay, exactly. Right on cue. Dr. Hawkins is also an RHP community pioneer. She's a mental health professional who stepped into the breach at the height of DC's AIDS epidemic through her work with Whitman Walker and beyond. And also, I am Kate Ruane. I am with the Rainbow History Project. I'd like to begin by turning it over to Ms. Carter to talk a little bit about her work at the beginning of the AIDS crisis. And we'll talk to everyone in turn after that.
Hi, good evening, everyone. I want to thank you all for coming out and listening to really it may be a rainbow history, but it's a moving history. It's not something that's just sitting still in the archives of the rainbow history. That we're still moving forward and we're still doing some work. And I want to thank the panelists, and it's a joy to be sharing with you guys. Well, let's see. It's a blessing to be able to still be alive and long enough to share the history that happened here in DC. And for me, I learned about what they called it AIDS at the time from a friend of mine that I lived with over on Columbia Road. His name was Chasen Gavers, a very talented performance artist. And he said, Colevia, did you hear about this disease is hitting white men, a gay white man? I said, no. He said, well, then, then it hit. It started spreading. Chasen found out that he was infected, and it went on from there. But my activism was not an accident for me. I grew up in a family that was committed to community involvement in rural Pennsylvania. My grandparents and my parents both were very much involved in the community. So it wasn't an issue of whether I was going to get involved or not. It was just something that needed to be done. And so, people my age, we were also exposed to a lot of activism in my lifetime. We had the environmental movement, the anti-war movement, the women's movement, Black Panther movement, the Black freedom movement, civil rights. So it was a natural thing for me to try to make sense of in terms of how those movements would come together in dealing with this issue of fighting for for our community as a gay community and as a Black woman. So I'm not going to talk too much more about it. I'd rather have some discussion about that. But we'll pass it.
Sounds good to me.
Yeah.
Ms. Nalls? Just a brief introduction.
Yeah. Okay. I'm Pat Nalls. I am a woman living with HIV. Was diagnosed in 1986 after losing my husband and baby. I guess we'll talk a little more of how I created the Women's Collective, but that's a little bit brief of who I am and what caused me to found the Women's Collective. And truly, there at the time, services for women were non-existent. When women needed help, they needed food, they needed transportation to get to the doctors, they were given one token. Many of those women never made it to the doctors because they couldn't get on a bus to the doctor because they had children. And at the time, we were not giving transportation for a family. It worked for the guys, it didn't work for the women. Food was delivered at home for the woman, for the person with AIDS. Moms, I literally watched them fed the kids and they didn't eat. And there are women who died of starvation because they didn't have food and no one was looking at this disease from a family perspective, from a woman's perspective. When women got sick, no fault of their own, their babies and their children were put into the foster care system. Now, we know how horrible that is. She did nothing wrong. She had no family in the area. She's from another part of the United States. She could have been from another part of the world. Had no family close enough. And so when she went into the hospital, her children were taken. That is no easy task for a woman to go back and say, I'm now out of the hospital. May I please have my children back? Now, that's an everyday thing for women of color, Black women. But when you add HIV to the list, you couldn't have been a good woman. So you did not deserve to have those babies back and those children. The very people that give you what you need to live and to fight the disease. So women became depressed. They lost their lives from fighting to have their children back. Keep in mind, they were still sick. They were still dying. So there are all kinds of things that happened to us that unfortunately, if we didn't stand up and fight, and the history always talked about it started with the men. But honestly, there were a lot of women with HIV back then. We were just not counted. We were not talked about. So many were left believing something that was untrue and hence got infected because we had doctors on TV who were saying women are not at risk for this disease, right? Some of us remember that. So there were a lot of things that were going on for us, myself included. I went from a 2 household income to a fixed income, a disability check. I was told I had less than 2 years to live. I had no T cells. I had an 8-year-old and a 4-year-old. And so all of what goes into that and living with fighting for your life and fighting to survive and taking care of other women. We became a network who felt like nobody cared about us. So we gathered in my kitchen and we fed, we shared our resources, we shared our pantry, we shared what we had, and felt very, very isolated, very alone, very ashamed. And then when we went out to seek help, we felt like we were invading somebody else's space. And many of us felt like that was intentional, you know. So there were all of these things that we were going through while we were all dying. Every day someone was dying. We went to the doctors together. We share our rides together. We made our appointments together so that we can share rides. And so we figured out how we can do it until, but you know, many women, I think, died because of that struggle.
So when did you start the organization?
Oh, yeah. So I started in my home in 92. Informally, but got incorporated in 95 and started out of my homeland.
And we will talk more about that.
As well as it's been a continuously running organization
Yes.
since then. And she's been the executive director since the beginning. Hi, everybody. I'm Valerie Papaya Mann. And as was mentioned when she talked a little bit about who we are, I've been the executive director of 3 different HIV and AIDS organizations. AIDS Project of the East Bay, which served the AIDS community in the East Bay area across from San Francisco. So it included Berkeley, Contra Costa County, on down even further, so maybe 12 counties. And then I came back to Washington, which is my birthplace, and became executive director of DC Care Consortium, and then after that, Africa AIDS Watch. But my story begins before that, because those things happened in the late 80s and then the 90s and so on. But my story begins coming out here in Washington, D.C. in the late 70s and becoming a part of a very artistic and wonderful community here in Washington, D.C. Individuals like the one that Colevia mentioned, Gavin Shaver, Essex Hemphill, and many other artists, Michelle Parkinson, and I can go on and on. Thomas Minor, Thomas Lucas, Gideon Farabee, and so on. And we were artists, and then in my early 20s, we were very focused on partying and having a good time. So we had the opportunity to enjoy the clubhouse, which if you didn't go, you heard about, where basically it opened at midnight, but nobody wanted to be the first one there, so we showed up at 1. And we danced all night long and came out in the morning. And when we come out, we'd always say, wow, you know, it was like the sun had turned itself on while we were partying. As well as the clubhouse and then the coffee house, which I helped Ray Melrose with. He and Gary Walker had it in their carriage house in the rear. And so us artists would go in there and do poetry and do songs, and then we charged $2 or whatever we were charging, and people would come in and we'd buy refreshments, and it was in the alley, and so it was called Unique Alley. And many other expressions, but we would put together shows and go do the shows, and I would do poetry mostly and be with the rest of the artists. That was the late 70s, but then we noticed shortly after that people began to get sick. So I don't want to leave out of this story that when I came out in the late 70s and started becoming a part of various circles, because I love a wide variety of people, and one of the circles was this guy, this lawyer named Jim Graham. And Jim Graham and I were friends and associates, and he was a lawyer, and he seemed happy doing that. And I was at American University finishing up with my master's degree in public relations and publicity, and I figured I'd go off and become this high-class New York public relations person and make $1 million, and then $1 million really seemed like a lot of money. Now it doesn't seem like so much money. But then one day, Jim and I got together for lunch to talk, and we noticed that my friends, his friends, were becoming ill. And he had been offered a job as executive director of the Whitman Walker Clinic. And he was tussling with whether he would make that decision to enter this field, because he knew it was very different from law and that you could make a lot of money in law. And then I was tussling with it a little bit because it seemed like something I might be getting ready to get involved in, and I thought I could go off on Wall Street and make a lot of money, and this didn't seem like that. But Jim eventually did accept that job, and you know that his story is a whole nother story that I'm sure will be told. But we developed, at some point after Jim became executive director, he asked me to develop materials for Whitman Walker Clinic. And I want to read to you a portion of what this one says. It first has an AIDS symbol on it. I do have it in larger copy, and I'm gonna send it around so you can see it. You can send that one around so they can see it, but I'm gonna read to you what it says. It says, blacks and other third world gays are highly susceptible to AIDS also, because at that point and always, AIDS has been an issue in the black community here in DC. The U.S. Public Health Services reports that as of August 12th, there are 1,972 reported cases of acquired deficit syndrome. And of the cases reported in the U.S., 57% of the victims are white and 27.8% are black. 14.7% are Hispanic, and the remaining 2% are unknown. To date, 759 cases have resulted in fatality. Figures indicate that at least 41.5% of those who have contracted disease are minorities. And then it goes on to talk about Whitman Walker Clinic setting up an AIDS education fund, because at that point, Whitman Walker Clinic was an HIV and AIDS STD clinic for men. And they were thinking to get involved in AIDS, and they invited Jim to come. And then Jim invited me to come to do this work. So we created a campaign that went to the general public, and then we created a campaign that went to the African American public. And then at that point, as I said, there were less than 1,000 cases of people who had passed from HIV. And this particular ad campaign, since that was my field of study at American University, was a 3-part campaign. So we created this one, which told about coming to the clinic for education, volunteers needed, open hotline 7 days a week, give us a call. And then I created this one, which says, Washington is a capital city, let's keep it that way. Blacks are highly susceptible to AIDS here in our city. There's been a solution, work with us to find that solution. And on here I quote numbers, and it goes up a couple of hundred. So this was part 2. And then the third campaign that I got, part of the campaign, is an AIDS forum for Black and third world gays. And it's actually talking about the numbers now are 2,157 reported cases.
What year?
I guess this was like 80, somewhere there. And there were 2,157 national reported cases, and 852 of those had resulted in fatality. We didn't know what was about to happen. And this was the beginning. And we're actually creating a coalition with the Clubhouse, where Andre Scott and his sister Paulette Scott were running the Clubhouse. And we were going to the Clubhouse, and more people were getting sick. And so when I created this campaign where there were fewer than 2,000 cases, I didn't know what was going to happen, but this is what I thought I'd be creating as campaigns. I just didn't know that for the next 30 years they would all be about HIV and AIDS until I couldn't do them anymore. So a lot of what I brought to share and to talk about was sort of the media work that went into this kind of stuff. At the same time, those same people that I was telling you in our early 20s were partying at the Clubhouse and the coffee house and down at all these clubs. I can't even name them all. La Zambra and Nob Hill. And oh, I'm so glad I've been taking ginkgo for my memory. Because you all might have got a whole different version of this conversation. Hey, at 65, it's a blessing to remember anything. And so a lot of what I have is some of the media stuff. And actually, these things, the Rainbow History Project has some of these things, and the Schoenberg have asked for my papers and so on. But a lot of what we did was create media campaigns, and these were some of the first. They were certainly the first that did outreach to the Black community. And if you listen to the figures, they were some of the first in the whole country. But we didn't know that then. And Jim thought he would get into it for a couple of years, and then he was going to go back and be a lawyer. And then this was how I got in. This is my door, even though later on I did go and become executive director of different things and do it from a different perspective. But media never stopped being my goal, and I do have some other things we can share about that. But that's the introduction. It was my friends. And I was graduating from grad school, and I thought I was going to be a media successfully person and blow up doing more events like she's been to many of my events many long time ago. But what we realized is that, because I was also involved with the political end of it. So by day, I'd run around with Ray Melrose and Essex and those guys. And then during the day, I was running around with Jim Graham and a whole bunch of people that we know today, and some of them, a whole bunch of them aren't here. And what we saw is that this was coming, and it was on the tracks, and it was so scary we didn't know what to do because the people were dropping around us like flies. And they were all in their early 20s. They were just little boys, young guys. So much potential, such a big loss. But my whole thing turned into trying to create the best media pieces that I could, and one of the things I'm really proud of is that the DC Care Consortium, we were able to do a gospel concert against HIV. I always wanted to take the approach of the community that I worked in, so you'd use the materials based on who the audience is. That seems very simple, but it's not always carried out. So I created media campaigns everywhere that I went, including Africa AIDS Watch. So we'll talk about that more, but yeah, it was in the beginning. And as I said, when I talked about this recently, Chai Hughes was in town, who helped start the first LBGT club at a HBCU. Are you with me? Okay. And so that was Howard University. So I was one of those people who was at Howard that did the first Black conference in the country. We were here in Washington, so we thought we could do everything national. We thought that was the coolest thing, that we could do something, call it national, invite people from all over the country. It's still what we do. It's still what we do. And so we figured we could just do national things, and that's what we did. We had a national conference for LGBT people at what was then the Howard Inn. It's now the Howard, that bookstore is where the Howard Inn used to be. and that was in the early 80s, and I had an opportunity to do public relations. So pretty much most of my public relations work ended up in either the queer community or the HIV community. I guess it was just the Creator that sent me to go get the training to be able to do it. And I'm happy that I was able and willing. So I'm going to let Pat do her introduction.
Thank you, Papaya. It's really nice to see so many people out here. I really appreciate that. I have this terrible feeling that so much of our history is going to be gone because we've lost so many men, and we're now losing our women as well as people get older. And it's really important that those of you who are younger know something about what it was like. I first got involved with my first patient. I'm a clinical psychologist, and I was running substance abuse treatment programs in southern Maryland, which is a very rural area at that time, and was deep in the closet. No one in southern Maryland was out, and I heard about AIDS, and I didn't know anyone yet. I saw my first patient in late '83, and it was a person, his family asked me to see him in the hospital. We didn't have the test yet. It wasn't even called AIDS yet. It was, gay man-related disease, if you remember GRID, gay-related immune deficiency syndrome. And he was so deep in the closet, he wouldn't even talk to me about the fact that he was in the closet. But he was being treated by everyone in full moonshot gowns. I mean, complete, with a mask and double gloves and the whole, just like they do with Ebola now. Later, of course, I did see patients at Howard, and we actually had a situation at Howard. I went to see a patient, and all these food trays, he'd been there for 2 days, all the trays were still outside the door. And Whitman Walker sued Howard on that case and actually won a very significant settlement for that woman. Unfortunately, by the time they got the settlement, she died maybe 2 months after we got the settlement for her. But that was not uncommon in all of our hospitals. It wasn't a Howard issue. It was Georgetown, it was UW, it was everywhere. People were so frightened. But again, people didn't know how you got it. There were theories about how you got it, but a lot of people thought it was airborne, which of course it never was. But people were afraid of that. I saw my first patients in treatment. I became a volunteer at Whitman Walker in 1984. We organized a training for therapists and mental health professionals because so many people were so depressed. People were committing suicide. They weren't sick yet, and they were committing suicide just because they were so afraid of what was going to happen and the stigma that was going to come with that. So there was a lot of need for mental health support. And I knew that once they started to recruit volunteers, they were going to get a lot of lesbians, because I knew in that informal gaydar way, there were a lot of lesbian nurses and a lot of lesbian social workers and a lot of lesbian therapists and a lot of lesbians in general. And they were gonna come out. And they did. They did. The helping professions came out, and they said we organized a therapy support group after the training, and we met every month for about 2 years. There were 18 of us in that group at one point in time, and there are only 2 of us left, and that's myself and my spouse, the women in the group. Everybody else died. And I've got to say something about those times. The first patients we saw in our office, we had a space up on the mental block. You all know where the mental block is in Connecticut, across from the zoo, where there are a million therapists have their offices. We used to call it the mental block. And we wiped down everything when these patients came in. We wiped down the doorknobs, we wiped down where they sat, we wiped down everything. And the next week they came back, and we said, this is crazy. If it's not, we don't think it's airborne. If it turns out it is, it turns out it is. We can't be going around wiping things off all the time. And what was the message that you're sending to the patient? I came on the board of Whitman Walker in '87. Jim asked me to come on as board director for the AIDS program, and I did. And then I came on staff in '89 when he asked me if I would come on as his deputy and have charge of all the non-medical programs. And I stayed there for 19 years. And so saw a lot of changes and a lot of development over time, and we can talk some about that later. But I want to make a point about the heroes of that early time. People were so stigmatized. My partner then, now my spouse, She was working in a medical facility, the old soldiers' home. And once people found out she was volunteering at Whitman Walker, people wouldn't eat with her. These are doctors and nurses in the dining room. That's what it was like for people who were just working with people. So you can imagine what it was like for the people who had AIDS and whose families knew they had AIDS. But the heroes that I think we often forget about that time was all the people who outed themselves, the gay men and lesbians who outed themselves by volunteering at Whitman Walker. One of the things we used to ask people when they came for interviews was how did they realize that by volunteering or working at the clinic, people would automatically assume they were gay. They weren't all gay. We had straight people too, but they were mostly gay. And people had to really stop and think about that because many people were still in the closet in those days. People were not out. And those people just came forward anyway. And the other folks were the HIV positive staff that we had. And I know there's some people here from Whitman Walker, Barbara Lewis, who remember that. These were people who were watching everything play out in front of them that was going to happen to them. And there wasn't any medicine, there was nothing. So, and we're not talking the way AIDS is now or HIV is now. We are talking PML, dementia, brain disease. We're talking, you'd see a patient on Friday and he could be dead on Monday from pneumocystis pneumonia. And that's what people were looking at that were working with, and they knew they were going to be in that same place. And the life expectancy when I started working with this was 6 months from diagnosis. Now, of course, diagnosis didn't come, we didn't have the test yet, so it was really when you had already gotten pretty sick. It got better. By 1989, I had 500 names of people that I knew that I had lost, either staff or patients or friends. And I had a much smaller list than some of my colleagues in San Francisco had at that point. And the worst it ever was for me was in 91. In a 2-week period, I lost 10 people. Went to 10 funerals in a 2-week period of time. One of them was a young woman that I had worked with. She died on her 21st birthday at Georgetown. She'd been 6 and she was 15. Her mother had killed herself because her mother had AIDS. Her mother was a drug abuser in New York City. The father of her baby had killed himself, and her baby had died of AIDS, and she was 15. And New York City called me and asked us in Washington, could we find a place for her to stay? They had no place for anybody like that in New York. And I had been a founder of Damien Ministries, and we were able to put her in our women's house. And later she moved into Whitman Walker. She fell in love with a guy at Whitman Walker, and Whitman Walker, the house, gave her this beautiful wedding. When she was 19, she had a beautiful wedding. She graduated high school. She did all the things right. And she died when she was 21 with her husband and me at her bedside because her family was all gone. And that's what it was like. And then the other group of people who get ignored all the time are the men who went to NIH and participated in the trials. I had to tell one of my clients, he wanted to go to NIH. I was ambivalent about it, but I told him because at that point your life expectancy was half as long if you participated in the trials. Half as long as it would be if you did not participate because they were using very aggressive things. He went in on a Saturday and was dead on Monday. They were heating the blood. You may remember that trial. They were heating the blood as hot as they could get it, and then they would give another transfusion because they thought that might kill the virus. Well, it also killed a lot of the people who were in the trial. So, and nobody talks about those guys. And he said, when I told him, he said, I know that, he said, but Pat, it's too late for me. Nobody can do anything for me, I'm too sick. But if what I can do is do something for somebody who's going to come after me, and they'll live a little longer, then it's worth every second of doing it. And he was dead 4 days later. But there are a lot of those men that we don't have an AIDS memorial that truly, and we should have in this Capitol, that recognizes all those people and the impact that it had on all of us in the community. So we can talk more about, the medical underground and the stealing drugs and getting drugs to people and a lot of assisted suicide, a lot of things from that time. But the heroes are the things I hope people will keep with them in their heads.
You all can pass that on the other side, and then
Can you pass the the ad?
so that they can see it too.
They did get it? Okay.
Okay, good.
Oh,
Yeah,
it's got to come forward, I think. So thank you again, ladies, for being here and for sharing your story. I just have some broad questions, and please, whoever wants to begin answering them, I'm happy to pass the mic off. My first, it follows on from some of the things that you have said. What were some of the specific ways that you identified needs that you saw and devised strategies to fulfill them? Patricia, you talked a little bit about the needs that you experienced and that you saw women experiencing. Dr. Hawkins, you were just talking about stealing drugs, things like that. I wonder if you could expound a little bit on. I think that's a rational response to the needs that you were seeing, and I'm curious if you could expound upon that. Would you mind starting?
So, I didn't, yeah. So I always say that if I had sat home and planned how I was going, all the strategies and how I'm going to start this agency, what goes first, what goes second, where I get the money, how am I, it would never have happened. So I just want to I think back then we all did what we had to do that was humanly possible, honestly. We didn't think much about it. We just kind of rolled up the sleeves and did what was happening. For me, again, as a woman who had just been diagnosed, thought I was the only woman. And so I know right away I needed to find some other women. Like people kept telling me there are some other women, but I couldn't see them. I didn't see them on TV. I didn't see them. So I went to my doctor and I asked her, am I the only one? And she says, no, there are some other women. And, but of course, I can't give you their information. But she gave me this little tape that had some women talking, and they were from an agency, a women's agency that was in existence at the time. And so I went there and I volunteered and I started to meet all these women. And before I knew it, I was having a support group in my home. Women were coming, flowing. We were sitting around creating wills. Who's going to have the babies? Who's going to do this, this, and this? So we just sort of operated like that. Like somebody didn't have food. What are we going to do about that? Let's try. So it was just, and then we helped bury people, women were dying. And again, I mean, this is not to harp on, but we felt invisible. We felt very, very invisible, and we felt like no one cared. And I think because of that, we just helped each other out the best way we could at the time. And that's what we did. So there wasn't any specific plan. We would, share things, do things. And then as I have friends who said, you know what, you're basically doing case management in your home. So I'm like, really? Am I? Like, you're finding the food, you're looking for this, you're taking this. I had kids in my home because when moms got sick, again, to avoid the children being taken away, I kept them in my house. Now, keep in mind, we're all very sick women. We are 80 pounds, we're 70 pounds, we're 100 pounds, we are dying. But we didn't know what else to do but that. And so we did whatever was necessary. Then, a friend of mine said, you need to just, it couldn't work in my house anymore, in my home, because I had no space. So Saint Anthony said, I went there, Catholic girl. I was like, can I borrow your basement? And they said, sure. And so we started there, and that's when we started just talking about what are we going to do? How are we going to do this? And things were hard. But that's when a friend of mine said, you need to, so I apply for some money, get some money somewhere, because I had been incorporated, but I didn't do anything with the thing. And so I got a little grant to get me out of house to just pay for a room. And I paid the person who was helping me, and I continued on my disability check. So from there, I was on the planning council. Pat Hawkins, remember my big mouth. But I tell you, that's where I learned a lot. And that's where I figured. And I was doing some consulting work for this, for the Center for Women Policy Studies. And they got a grant from HRSA, and they said, well, since you're helping us on this grant, we're going to put you on the planning council. I was like, what is that? And then I walked in there, and it's a table full of guys mostly. And everybody was talking about what they want, what they need, what they want. And there were nobody saying, well, what about the children? What about the families? What about the women? What about the babies? You know, it was really not a conversation that was going on around that table. And so, and the more I yell and the more I scream and the more I push for it, you know, people became resentful. And so you have to stand your ground and you have to push and scream and holler. And I remember we did a 2-day, a weekend of a 2-day training for women with HIV. And it was called, we could name it Fighting for Our Lives. And we went there, and there were like 100 women. And so after you go there for the 2 days, we ask you to sign something saying you will come to this thing called the Planning Council. Because it was sort of an advocacy training. And they were like, what is that? And we're like, we'll meet downstairs and we will go in. Because we had been asking them to provide childcare at the Planning Council, to provide food at the Planning Council, because women cannot come without these things, you know, and it was always no, 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 we don't have it, we can't do it. So finally I said, bring the babies, let's bring them, let them run wild, let them do whatever they have to do, and let's not shush them at all. And sure enough, those children, a lot of the women came, not maybe about 30, 35, and they brought the babies and they were running, and there were some people around there like, oh my God. And I tell you, after that, we had food at the Planning Council and we had childcare at the Planning Council. But, you know, we were so frustrated that we figured whatever we had to do, we will do. We had to survive some kind of, they had to listen and they had to hear what we're saying. You know, and eventually I think our voices were heard. We started helping to make changes around making things family-centered care versus the person with HIV. So that's where I think I learned a lot. I learned how the money comes in and how it's spent, how it's divided up. You know, permanency plan, there was nothing that women can really use that was being broken down. Case management, like permanency planning, childcare, all those things, you know, really, respite care for women, things like that were not there. But with a lot of advocacy, we were able to get some of those changes. So we started at that table, and then it enabled us to be able to create some of these organizations, frankly, for Black gay men too, because, you know, they were also in a similar bind as women of color, because they were also not feeling like their needs were being met and that they were welcome in all of the spaces. And so they were taking people to their home and taking care of them and having them die. And so out of that created us helping us, right? People into living. So it is unfortunate that we had to be in those predicaments, in those situations, and to be sick and having to create spaces that we can take care of each other because we weren't getting our needs met. So, you know, that's how a lot of us came about and were created because of that need that were not being met.
Would anybody else? Colevia, I saw you nodding along.
I was not. I'm gonna come in front of you. I was just thinking about it, what Pat was saying and what Pat and Pat. That's what I thought. A lot of my involvement, because of the position that I held in government, involved a lot of grant writing and contracting to groups like Pat's and Whitman Walker, stuff like that. But you know, as an individual, even if even if you didn't have a position or was not directly affected by it, you know, a lot of this work required crash courses in medical terminology and respite care, death and dying, and helping people write obituaries, and dying and dying a good death if it was all possible. And so my my urgency was to get places like Damien Ministry to get them the money that they needed, and also the house. I'm trying to think of the house, the nuns' house over on. Yes, there was just so many needs being identified, and having those crash courses and learning all the information from the very beginning. You know, even where you were, you could start identifying needs, especially if you worked in an institution like I worked in. And I worked in the Department of Corrections as a community relations volunteer services. So right there, I was gifted the opportunity to bring different resources and information into the prison system. So I contacted a guy by the name of Billy Jones, who worked at the Whitman Walker Clinic, and we set up a series of training for the inmates at Lorton, at all the facilities, the maximum facility, minimum youth facilities. And not only that, but also their families who came on Family Day. We made sure we had outreach and information for them as well. So identifying resources is, and the need is through information. You got to have the right information.
One of the things I wanted to go back to do is to go to the heart of why you invited us here to talk about women in leadership positions, or lesbians in leadership positions in the HIV movement. And I don't want to lose this opportunity to say we were absolutely at the forefront. And sometimes that gets lost in history, just like history has been a little bit rewritten even here in DC about who did what. That's why it's important for us to tell our own stories, I might add. That's why it's great to be a part of the Rainbow History Project, I might add, is the story has been told as it occurred. But there were a lot of us, these were our friends that were dying and that were getting sick. And we weren't in a segregated community. The women and the men were very close together. We didn't ghettoize ourselves so that we weren't together. So we partied together. We enjoyed each other. We played together. I think most of us had to go to work because we spent a whole bunch of money partying and playing together. So it took money, and we had to go to work to make the money. But other than that, we were already a community. And having lived in different places around the country, in the San Francisco Bay Area, which was very hot and the epicenter of the HIV movement, we were lucky to have each other here. And there were lots of women who participated. But somehow that doesn't always come through. And I must go ahead and also admit that I didn't always feel respected doing the work that I did. At one point, at AIDS Project of the East Bay, being an executive director, I had 65 people, working for me. All kinds of people. Half of them were HIV positive. Half of them were struggling to try and come to work. Somebody described earlier who was there. Some of them were drag queens. It was the most, after working and doing that job, I can do any job in the world.
Attention everyone, the time is 8:30 p.m. The library checkout service will be closing in 30 minutes. If you need a new library card to check out books, please come to the checkout desk. If you use the restroom, please do so at this time. As a reminder, if you're in a meeting or study room, please work in preparation for closing. As a final note, the public computers will be shutting down soon, so please be sure to save and print information that you are currently working on. If you have any questions or need help, ask library staff. Thank you and have a good night.
Yeah. So we were in the struggle. We were in the forefront of the struggle. And so many of us gave our lives into this. And I can't tell you the amount of times that it felt contentious, that it felt like we weren't accepted as women. Then we had to fight with each other for funding because it was limited. It was a kick-ass job is all I can say. We gave heart, body, and soul, as well as we had to watch friends dying. I remember running out of Rankin Chapel at Howard University because I just couldn't, since I was one of the only women that they knew, I was always invited to speak at their memorial services. I just couldn't do it anymore. And then working around the clock, making sure grants are written, making sure that you have services. It was very difficult. And so I'm really appreciative that the Rainbow History Project decided to invite us this evening to talk about women's involvement in the HIV movement. We've always been there. We've always been caretakers. We were the ones that went to the hospital, that helped give those eulogies, that helped write those grants, that helped start those organizations, that went to those people's families to break the news to those families. It was horrendous. And women have always stood up and been a part of that. And there's a debt that is owed in that regard because it was kind of sort of abusive being in that environment because I've had many people tell me, you don't know what it feels like. And then we started serving the double and triple diagnosed who had
An officer in the
drug.
building, if you could please come to the circulation desk. If there's an officer in the building, could you please come to the first floor circulation desk? Thank you.
These people not only had HIV, but then like the people came with mental health issues, alcoholism, drug abuse issues, homelessness. This is who we had to serve. And even today, it still is who is needing to be served. So yes, absolutely, women were in the forefront. We helped lay the foundation. We were sisters to those guys. And then we were mothers to some of them. And when the families turned their backs on them, we were the families that showed up for them. I want to make that clear because we don't always hear our story.
Yeah, ditto that. When I said stealing medicine, I didn't quite mean that. I meant using medicine illegally, okay? What would happen and if somebody died or was in the process of about to die, someone would they'd have one of their friends or we'd contact one of their friends to go and get their medicine when this was AZT when AZT first came out and when people were so hopeful. But a lot of people couldn't afford it yet. We didn't even Ryan White hadn't even started fooling. We didn't have ADAP yet. We didn't have a lot of the programs that we put in place. So people would in fact clear out the medicine chest and bring those. And of course, they didn't, officially the clinic could not do that and the medical people had nothing to do with it. But the social service people were passing out people's pills. Barbara, I didn't want to, I didn't want to guilt you. She's acknowledging they did it too. And later on, when the new drugs came out, the same thing for a while. They're very hard to get, and we also got them down to other countries. We'd ship some down to Mexico and places like that did not have the before we had PEPFAR and all the things that happened later on. But I think what Pat Nalls said is crucial to this. You saw a need, and then you developed a program. It didn't come, I think I'll have a program. It came, here's a problem, and how do we fix that problem? So, Whitman Walker got into wills because all these men were dying. Never, 22 years old, you don't make a will. And their parents would come in and take everything. I mean, literally. Their parents would not let their lovers in the hospital rooms. But you got to remember that these parents were often struggling with finding out they had a gay son. They had no idea, and he was dying, all at the same time. So they had a lot of mental health issues around that. And I'd like to comment, I didn't say anything about Children's Hospital. I'd like to say some of the cool, and these were lesbians up at Children's Hospital, nurses, came up with for their moms of their kids, which was to have their mothers make recordings. We didn't have videos then. Make recordings to be given to the children later at special times, for their weddings, for their graduation from high school. And nothing helped those kids as much as those things did. And when they had the videos to make, and they had those kids would sit, those little 3-year-olds and 4-year-olds, because they would never remember their moms later. And most of those folks, a lot of them were poor, and they didn't have cameras at home or anything like that, so there was no way to capture that, so they would know who their mother was and that she loved them very much and what she thought. Because a lot of kids, when they lose a parent, feel like they've been rejected by that parent. So it was a very important part of death and dying to help those children and those mothers get some closure on that. But it was also heartbreaking to watch those moms film those things eventually when we did get video. I think the issue with other issues, like one example, I was a founding member of Damien Ministries. My patient was was Lou Tisconi, and one of my very first patients. And he'd been in seminary and was diagnosed and came to Washington. He didn't know where to go. He's in seminary in Texas, had no idea where to go. Came to Washington because he heard we were doing some stuff here. And from that came the idea of Damien for priests, because priests all across the country were being thrown out of their rectories and put in little tiny rooms somewhere downtown, nowhere around their parishes, and dying alone and isolated. So Damien Ministries was formed to meet that need. And then you had the same thing happen with the DC Care Consortium, which Papaya was executive director of, was formed to meet the title. I won't get you into all the issues of Ryan White, but it was formed to help get money out to new organizations that were beginning to come together. The Metropolitan AIDS Service Coalition, I was a founding member, and that was the precursor of Ryan White. My first AIDS meeting, Pat mentioned, my very first AIDS meeting that I went to was I'd just been on the job about 2 weeks, and I was sent down by Jim to there was a group of people meeting in the city government had called a committee together, an advisory committee kind of thing, long before the planning council. And went down to this meeting, down at the health department, and I sat, and I'm used to mental health meetings where everybody's very nice to each other, and how do you feel about that, and all that kind of nice, caring things. And these two men one man leapt across the table to strangle the other man, because he wanted money for this and the other guy wanted money for something else. And I had never seen anything like, I was dumbfounded. It took me a minute to even respond. I had no idea that meetings could be like this. But that was the contentiousness. And Pat's talking about, I remember when they brought all the kids to the planning council, and there were kids everywhere. They were all running around, and yeah, we got childcare the very next meeting. And that's kind of how you had to do it. You had to. And the same thing with medical marijuana. I was sending 85-year-old people on 2 canes, not just one like I'm on tonight, out into alleys to score marijuana so they could eat. This is before we had the appetite stimulants that we have now. And people were wasting away from not able to eat. And marijuana fixed that. The other good thing marijuana did is it helped with depression. It helped a lot of people feel better, and that meant a lot to us. But that was crazy. So we started the initiative to get marijuana passed in '98, and it took us more than 10 years to get it actually so that you can actually buy marijuana now in the district. So a lot of progress in this city in the health area in general. The whole idea of case management, comprehensive case management, the whole idea of meeting the needs where clients were, that really came out of the HIV epidemic. That's now it's become a standard practice of everything. So there's an awful lot of history there of how people met those needs and identified them. And Gift of Peace, I was on the founding member of the AIDS Task Force, Interfaith Task Force, and Gift of Peace I was Catholic too, so I went and decided that we needed to get a hospice going here, and what better than the nuns. So we got Mother Teresa to come here to Washington and open the Gift of Peace. And I will do a few days in purgatory for that, because for a while, they did not know how to deal with Washington. First thing, I went to see a patient once, and they had him covered in miraculous medals. He was Jewish. His family was not really happy that he was covered in Catholic medals, so I had to explain to them that wasn't a good idea. And then they closed on Thanksgiving. They didn't realize that was a big holiday for us, and so all the patients couldn't see their family. I mean, they had a lot of they were we had to take the air conditioning out of the building, the Catholic Charities owned when they opened Gift of Peace, because they didn't believe in air conditioning either. So we had to put it back in again after the patients came. They're a very basic order, and not the kind of nuns I was used to, but they're wonderful people, but they just did have no idea. So a lot of stuff we did was trial and error, and a lot of stuff we learned from after you did it.
Can I add something? I'm Dr. Robin Halpern Hawkins. I'm Pat Hawkins' spouse, also clinical psychologist. One of the disenfranchised groups that I dealt with in the Department of Mental Health was trans women.
Yes.
And nobody at DMH was willing to call these folks by their chosen names, and were willing to house them in, this is inpatient, we're willing to house them in dormitory rooms with their chosen gender. So that was a big mess. And when I first got there, we had, and I'm talking seriously and persistently mentally ill folks. I'm not talking about trans people as that, but these were ill trans people who also had HIV. And this one person decided that she was going to crawl into a ceiling like this in order to get over the door, to get out of the locked ward. In the process of doing that, she cut herself. So she is bleeding profusely, and there is blood running down her and running out of the ceiling. And no staff member is willing to go anywhere near this person because they are terrified because the person had HIV. And this one person infected, that I knew of, 6 different people because using drugs with her father, who had sex with her mother, the person had also conceived a baby with a woman, and so the baby and the woman were infected. And the person, and she was also very promiscuous on the grounds of St. Elizabeth Hospital, as many people are. You know, you walk around and you see people having sex under trees. And it took everything I could do to get condoms to be able to give out to these patients because no one wanted to admit that they were having sex. But you could see them having sex. I mean, it was utterly ridiculous. The amazing thing about her was move forward. This was 1989. Actually, the first person I saw with HIV was in 1983 in Crownsville Hospital Center when I was doing my predoctoral internship. But when everybody was terrified of it and nobody knew how you got it and everybody was freaked out. But move forward from 1989 to 2003 when I came back to inpatient, and there she was again. And she was in many of my groups and we remembered each other from all those many years ago. And then she got very sick and she died, and Pat and I were among the people with Earlene Budd, who raised money so she could have a decent funeral. But the drugs, the antiretrovirals really helped her. But that was a very disenfranchised group of people within the Department of Mental Health, and I would imagine in other agencies too. Because they were insisted upon calling her Mr. So-and-so, and she would insist on her name, and her husband was incarcerated in the John Howard Pavilion, which was the part of St. E's for the quote-unquote criminally insane, and she would talk about him, and nobody but me would give her any reinforcement for having a loving relationship with anybody. So I just wanted to throw that in.
I just wanted to add, we haven't talked about the adolescents, and I after I left the Department of Corrections, I came to the Health Department on recommendation of Dr. Hawkins, and I worked with the Office on AIDS Activities, which was the jumping point to transfer to the Office of Maternal Child Health, which was a better fit in terms of what we're trying to do, reaching at-risk youth, which included not only HIV/AIDS but substance abuse and other things. But I just wanted to make sure that we got that in, that our community took care of that population quite well. And there again, we used it as a wraparound and a coordination of existing programs that were already in existence, and make sure that they really reached out to that population. So.
Y'all all don't think about how hard getting condoms places were, how hard it was to get condoms any place back then. I ran my drug program, as I said, in Southern Maryland, and I had a lot of adolescents primarily. And the way I got our kids to start using them is I put them on the backs of the bathrooms. I had to deal with my board and get their permission and all this kind of stuff. Put them on the backs of the bathrooms and put them that said small, medium, and large. So when we just had condoms, no one took them. When we put the large condoms up, they all went. That's
Yeah, I would love to. I just want to say thank you so much for the work that you've done. My concern is what Pat has brought up. As a woman, we are always second place. We're there, we're in the front, and we're the fighters, we're the supporters, and nobody reaches out to us. We diagnose heart attacks based on how a man's response is, and that has only started to be addressed in the last couple of years. So there's a lot of inequality cutting across racial lines, religion, beliefs. It's male and female. And that's really the only separation that the human race has. And I think what Pat did, starting as early as she did, I remember.
If there's an officer in the building, can you come to the checkout desk? Thank you.
I remember AIDS being called the gay cancer, and that was in 82, 83. And we didn't know what the hell was going on. I'm from New York, so, you know, half the population, the male population was wiped out. But we never heard about the women until it was in the 90s, and we were like, what do you mean the women have AIDS? You know, we figured it was just the guys having sex with one another. Why would that affect us? Not realizing people were on the down low, and people were bisexual, going from relationship to relationship. So I want to acknowledge and thank you for the work that you've done for each one of you. Thank you.
I wanted to say something about something that you just said.
I just wanted to mention, early on, there were lots of women who also passed from HIV. Some of them that Pat talked about, but some of those women were in our community that sort of identified as lesbians. They were bisexual. And I discovered in hindsight, because I wasn't one of those, that many of them were having sex with gay men.
The time is 9:50 p.m.
And
The library checkout service will be closing in 10 minutes.
it was a
Checkout books, please come to the checkout desk. At this time, all meeting and study rooms must be vacated. If you use the restroom, please do so. If any questions, you help ask.
They're serious about these books now, because they're gonna have y'all arrested, okay? So it was very interesting that a lot of the women we were very close together, so a lot of the women party with the guys too. You know, and that doesn't get talked about so much. When we went to the clubhouse, everybody was in there. Really, I'm telling you, people came from all over the country to go in there. There were straight people, gay people, bisexuals, transsexuals, and a whole bunch of people that I can't even tell you who they were. But everybody went, and there was always late night partying. So a lot of women, we don't acknowledge those women who were bi and who left. Many of them did not want to acknowledge that they had HIV because it was like reverse discrimination, that you're in the community and now you come up with this. Right. So you don't want to out yourself as being a bisexual, so you just kind of tell people just the symptoms. Oh, I have this, I have that. And a lot of women went into hiding around that. So I'm glad that you actually mentioned that, because it made me remember a lot of the lesbians or bisexual women who also suffered, but had nobody really there to speak for them.
I need to address that too.
Ms. Nalls actually asked to go first, but then.
Yeah,
then
and that triggered for me also that there were several women in the women's collective support group who were actually lesbian women. And I have to tell you that those women died a very lonely death. Those were the women who had been disowned by their families. They had no families. They had been in lesbian relationships for 10, 15 years. They had no idea. And then when HIV hit them and they found out, they were also shunned by the lesbian community, who kept blaming them for bringing AIDS into their community. They went to, I think there was a lesbian support group, and they would hear in that support group, they will be sitting in the group and hear the folks in the support group talking about lesbians who are bringing this disease into our community. And they were sitting there, they were hurt, I know several of them who died alone with no one there. And those are also lesbians who helped some of the gay guys as they died, but had no one there for them. So that triggered what you know, and you know, in the support group that we started at the Women's Collective, it was gay women, it was straight women, it was any woman. You come in, and it was DC, Chocolate City, so it was predominantly Black women. So, but those were some of the saddest deaths that I have seen, to be very honest with you. Family, none. Community who became their family were talking about them, shunned them. They were so ashamed. So
Yeah. I also want to address that I was part of an organization that sponsored the first East Coast National Women's AIDS Conference in 1986. So it was pretty well attended. It was down the district building here in DC, and the problem with a lot of women not knowing until the 90s was because it was the population that was affected. They were on the edges. They were already outside of anybody that people would normally know or want to even be associated with. And the other thing is that it depends on your perspective, that it was, a lot of people thought that it was the bisexual women that were causing the problems in terms of, and it wasn't necessarily the lesbians, you know, because.
there was substance use too.
And so, but the thing is that's the not so kumbaya stuff that was happening in the community, that was kind of that was a rumbling in the community, the social political stuff that was going on with this. I wish we had more time to talk about that.
I wish we had more time too.
But that's when I get really excited. Yeah.
I think we're going to have to do this again, ladies. I hope you're ready to come back. Thank you so much.